For the KBIA Health and Wealth Desk, I'm Sebastian Martinez Valdivia. This summer, Missouri was an early hotspot for the Delta variant of the coronavirus, leading to more severe illness among young people, including expectant mothers. As KBIA's Rebecca Smith reports, many OBGYNs across the state are now worried about severe COVID complications for moms, including stillbirth.
Dr. Rebecca Hamill is an OBGYN at St. Luke's Women's Health North in Kansas City and says when it comes to COVID-19 and expectant mothers, it's simple. Moms are scared.
I so very understand that. I mean, on a personal level, I am a pregnant obstetrician. I'm in my third trimester. I understand the urge and desire and fundamental need to make sure you're making the best decision you can for your health and for that of your baby.
Hamill adds that right now, those fears are justified, as OBGYNs are seeing some new worrisome complications arise from COVID infections during pregnancy.
Fortunately, most of my moms have uncomplicated infections, but unfortunately, we are absolutely seeing the rare exception to that at all gestational ages.
In the first trimester,
we are seeing an increase in miscarriage.
And in the second and third trimesters,
we're seeing an increase in that need to be ventilated, that need for respiratory support. We're doing preterm deliveries. We're doing unplanned emergency C-sections.
And on top of all of this, OBGYNs are worried about early data showing a dramatic increase in the stillbirth rate, like in Springfield, Missouri, whose younger unvaccinated population was hard hit this summer by the Delta variant. According to the Centers for Disease Control and Prevention, stillbirth affects about 1 in 160 births. But in August at Mercy Hospital in Springfield, 23 out of the 222 moms who gave birth had COVID, and 6 of those 23 had stillborn babies. That's a rate of 1 in 37 births, compared to that average rate of 1 in 160. Now, this data is limited, but maternal and fetal doctors in almost every major population center in Missouri say they're seeing something similar.
We have pregnant patients that are testing positive for COVID essentially every day.
That's Dr. Chandria Johnson. She's an OBGYN at Mercy in Springfield. She says they've been seeing more COVID-positive moms with abnormal placentas. They're showing evidence of vasculitis, essentially inflammation and restriction of blood flow to the baby.
And unfortunately, we don't really have a way to predict that, but there definitely is an association with COVID affecting the placental blood flow and circulation.
Now, Dr. Geeta Swamy is an OBGYN at Duke University, who's part of a national work group of doctors looking at COVID's impacts on pregnancy.
Thankfully, we're not seeing those kind of things widespread, but with how aggressive the Delta variant is, I would not be surprised to find that we start seeing more signs of how that virus is impacting pregnancy.
She adds that it's still too early to draw any broad conclusions or make any recommendations nationally, as more data is needed. Back in Kansas City, Dr. Rebecca Hamill says it's been heartbreaking to watch families experience these severe outcomes, especially because the vast majority of the mothers with severe complications have been unvaccinated.
One extra maternal death, one extra stillbirth is too much. That's unacceptable. So I will advocate for vaccination. What's safer? Vaccination, hands down.
For KBIA News, I'm Rebecca Smith.